Imagine waking up with a cataract clouding your sight or a hip that grinds like sandpaper and being told you'll wait months, maybe even a year, before anything happens. Now flip that. Same problem, same medical science, but you're seen this week and in surgery within weeks. The difference isn't the illness, it's the system. Today, we're counting down the top 5 healthcare systems in the world with a laser focus on what patients feel most. How we're ranking. Of course, the phrase best healthcare system can mean many things, so here's how we're judging. First and foremost, waiting times. How quickly can you see a GP, a specialist, or get that surgery you need? Second, reliability at scale. It's not about a lucky exception. It's about whether the average patient can count on access. Third, the policies and capacity that make those waits possible to shrink. How many beds, how many staff, how many surgeries per year, and whether there are hard guarantees in place. And finally, the trade-offs. Because every system buys speed in its own way, sometimes with higher costs, sometimes with heavier strain on its workforce. Number 5. The Netherlands. Standards that set the bar. The Netherlands makes a bold promise to its citizens. They literally codify how long you should wait. Known as the Treatnormen, the targets say no more than 4 weeks for your first specialist appointment and no more than 7 weeks from the decision to treat to the actual treatment. Hospitals even publish their current waiting lists publicly, and insurers offer mediation to reroute patients to faster options. But in reality, pressure has been rising. By 2024, nearly half of all outpatient waits exceeded that 4-week target, especially in orthopedics and gastrointestinal care. Common surgeries like knees and hips often slipped beyond 7 weeks at many centers. Still, the Netherlands earns its place because of something unique: transparency. Patients can compare waits across hospitals, switch pathways, and hold the system accountable. The standards themselves create a culture of urgency. The design is elegant, even if demand has outpaced it. Number 4. Switzerland. Fast access, high price. In Switzerland, speed is the norm. Compared to most high-income peers, Swiss patients get faster access to specialists and elective procedures. Survey data repeatedly shows Switzerland near the top for avoiding long waits, and surgical throughput is another sign. The country performs joint replacements at one of the highest rates in Europe, a signal that operating rooms are open and active. That said, there are still cracks. Mental health services in Switzerland often mean waits of over a month for adults and nearly 2 months for children and adolescents. And the price of speed is high. Switzerland spends heavily on healthcare, and patients shoulder some of the burden directly through out-of-pocket payments. The system delivers, but it is not equally easy for everyone to afford. Number 3. Singapore. Small, smart, and fast. Singapore runs on a small but smart model, and nowhere is that clearer than in specialist access. In 2024, the median wait from referral to specialist outpatient clinic was just 35 days for subsidized patients and a remarkable 12 days for unsubsidized patients in public hospitals. That's a pace most countries would envy. Even in the emergency department, Singapore maintains unusual transparency. Daily medians for ED to ward waits are published, sometimes 5 to 7 hours depending on the day, with surgeries explained openly to the public. Patients can even check real-time estimates through apps, helping to spread demand and manage expectations. Let's talk about the sponsors of this video, Noah AI. You are a medical student who sits late at night, surrounded by textbooks, scrolling endlessly through PubMed, searching for the right studies to finish a literature review, or a doctor who prepares for tomorrow's clinic, trying to make sense of the latest trial data and new treatment guidelines. 2 different roles. 1 common challenge: too much information, too little time. Noah AI was built to solve this very problem. It is not just another search tool, but an intelligent agent designed specifically for life sciences. Unlike generic AI, Noah thinks like an expert in the field. It clarifies your question, breaks it down into smaller parts, and then searches across the world's most trusted biomedical sources to build a complete, evidence-based answer. Let's look at an example. Suppose the question is, what is the current evidence for GLP-1 agonists in obesity management? Noah begins by clarifying the query, identifying the key dimensions that matter: efficacy, safety, clinical trial results, and treatment guidelines. Once refined, it builds a plan. First, scan PubMed for the latest peer-reviewed studies. Then, check authoritative sources such as the FDA and UpToDate. Next, map ongoing clinical trials, and finally, organize all findings into a structured response. Within moments, Noah presents the results: a summary of trial outcomes, details on side effect profiles, and clear references that can be traced back with a single click. Even the PubMed entries display impact factors, helping you judge the weight of each piece of evidence. It doesn't stop there. Noah reflects on the sufficiency of the data. If more information is needed, it plans further steps automatically, ensuring answers are not just fast, but reliable and comprehensive. For the student, this means hours of manual searching are reduced to minutes. Instead of wrestling with endless tabs and scattered notes, they now have a referenced, structured foundation for their literature review or class assignment. For the doctor, it means having confidence in clinical decision-making, with up-to-date evidence at their fingertips, ready to support patient care or inform ongoing research. Noah AI is more than a research assistant. It is a partner for learning, practice, and discovery. By combining professionalism with accuracy, it helps medical students study smarter, researchers explore deeper, and doctors act with greater confidence. Whether you are just starting your journey in medicine or already balancing the demands of practice and research, Noah AI brings clarity to complexity. Think faster. Work smarter. Analyze like an expert. That is the promise of Noah AI. Discover more at noahai.co. Noah is now in beta. Users who sign up via the link will get an invitation code within 48 hours. Check out the link in the video description. Number 2. Germany. Capacity at scale. Germany earns its place not with promises, but with capacity. The country's statutory insurance model, combined with optional private coverage, supports a dense network of providers and one of the highest surgical throughputs in Europe. When it comes to hips and knees, the procedures that clog waiting lists elsewhere, Germany often moves patients from referral to operation in as little as 2 weeks or a few months at most. Not everything is perfect. Privately insured patients do sometimes get faster access than those under statutory insurance, and Germany's data reporting isn't always as tidy as its neighbours is. But the machine works. Operating rooms are staffed, beds are open, and the surgical lists keep turning. For patients, this often means shorter waits and quicker relief. Number 1. Japan, the no waiting list outlier. Japan is the global benchmark for speed. The popular phrase goes, "Wait 3 hours to see a doctor the same day." In other words, you may queue at the clinic, but you are seen that day. Compared to countries where patients wait months for an operation, Japan's system feels almost alien. There are virtually no waiting lists. Patients have free access to specialists and hospitals, and they use it frequently. What makes it possible is an open access design combined with a hospital culture where beds are abundant and lengths of stay are long. Doctors and nurses work exceptionally hard, and certain rural and surgical specialties face real strain. Still, when the question is simply, how soon will I be seen? Japan sets the pace for the world. Why waiting times differ? Looking across these 5 systems, 3 themes emerge. First, targets and transparency matter. The Netherlands' Treek Norman and Singapore's daily dashboards prove that publishing waits changes behavior. Second, capacity is policy. Germany and Switzerland demonstrate that surgical throughput and dense provider networks are the engines of shorter queues. And third, design matters. Japan's open access and culture of constant flow show that speed doesn't always come from more money, but from system choices that keep bottlenecks inside the day rather than stretched across months. What these 5 teach us. If there is one lesson from these comparisons, it's that targets and transparency beat wishful thinking. Numbers on a dashboard alone are not enough. Without staffed operating rooms and available clinic slots, lists don't shrink. That's why capacity is as much a policy choice as funding. And design choices, whether to gatekeep access or to keep it open as Japan does, can make the difference between waiting 3 hours in a clinic and 3 months on a list. No one system gets everything right. Switzerland's speed comes at a high price. Germany must balance equity between private and statutory patients. The Netherlands has elegant standards but still wrestles with demand. Singapore manages speed but must deal with surges. And Japan's model depends on extraordinary effort from its workforce. But each offers lessons in how to manage one of the most pressing issues for patients. Not just if they will be treated, but how soon. Honorable mentions: Brunei Darussalam, small nation, strong commitment. Brunei delivers free universal coverage for citizens and permanent residents, with almost no cost at the point of service. The government invests heavily per capita, ensuring strong staffing ratios and well-equipped hospitals. Waiting times are generally short for both primary and secondary care, thanks to the country's small population of under 500,000. Taiwan, a model for single-payer efficiency. Taiwan's national health insurance, introduced in 1995, covers nearly the entire population with low premiums and small co-payments. Every patient carries a smart card that records their history and allows real-time billing, making the system both efficient and transparent. Waiting times for GP visits, specialist consults, and even many elective surgeries are among the shortest in the world, helped by the IT backbone that manages capacity in real time. The challenge lies in sustainability. Doctors often manage very heavy caseloads, but for patients, access and speed remain excellent. Norway. Long waits but world-class outcomes. Norway doesn't make the top 5 because elective waiting times remain longer than in Germany, Switzerland or Singapore. But it does deliver some of the best health outcomes in the world, with generous coverage and very low out-of-pocket spending. Conclusion. As we reach the conclusion, the question becomes clear. Would you accept lower costs but longer waits, or higher costs with near zero waiting? There is no single right answer, only trade-offs. But by focusing on waiting times, we glimpse healthcare through the eyes that matter most, the patients. And perhaps that's where every ranking should begin.
Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to our channel.